Welcome to The Explainer. Today, we're jumping right into a deeply personal, often misunderstood topic, identifying the common signs of infertility in both men and women. Whether you're trying to build a family right now or just planning for down the road, let's unpack some clear, actionable insights straight from the medical experts.
But before we get into all the clinical signs and the hard data, I really want to ground this in a real human experience. The author of our source material actually shared this incredibly personal reflection. She wrote, "I was 26 years old when I was first diagnosed with infertility, the result of a condition called stage 4 endometriosis." She goes on to talk about this profound heartbreak. Like so many of us, she'd always envisioned having a big family, and the sudden reality of repeat IVF cycles absolutely devastated her. It's so important we start here, because infertility isn't just some clinical box to check on a chart, it's a massive emotional journey that can literally alter your life plans.
Okay, let's dive into this. Here's our agenda. First, the reality of infertility. Second, common signs in women. Third, common signs in men. And finally, the takeaway and next steps. Starting off with Section 1, the reality of infertility. Let's get a foundational understanding of just how incredibly common this struggle truly is. Here's the most crucial point. Between 15 and 20% of couples trying to conceive are going to face trouble with infertility. I really want that number to sink in for a second. If you're struggling right now, you probably feel incredibly isolated, right? But statistically speaking, a massive portion of couples are walking this exact same path. It's so important we normalize this early on. You are absolutely not alone here. And you know what makes this uniquely frustrating? It's this precise fact. Many couples have absolutely no symptoms until they actually start trying to conceive. You might feel totally healthy, go about your day-to-day life without a single red flag, and have zero reason to suspect any issues whatsoever. It just stays entirely invisible until you actually start trying to get pregnant, and those months just start ticking by without any success. However, when signs and symptoms do pop up, they're often linked to other underlying conditions. Take pelvic inflammatory disease, or PID, for example. PID is a condition that can actually block the fallopian tubes, literally preventing fertilization. And the cause? Our source notes that 10 to 15% of untreated chlamydia cases actually lead to PID. It really highlights why staying on top of your overall reproductive health care and treating any underlying infections is just absolutely critical. Moving right along to Section 2, common signs in women. Let's look at the specific physical signs women should be keeping an eye out for. We've got to start with the menstrual cycle. And I want to ask you this. What actually counts as an irregular period? Because there's a massive misconception out there about cycle timing. So many women assume that if their period doesn't show up on the exact same numerical day every single month, something must be completely broken. Well, let's contrast a normal, consistently around 28-day cycle with a truly irregular one. If you have a 33-day cycle one month and then a 31-day cycle the next, that's still generally considered normal because it's pretty consistent. An irregular cycle, on the flip side, varies so wildly you literally can't even estimate when it's going to arrive. That kind of extreme, unpredictable variance, that's a sign you really shouldn't ignore. It can be directly tied to hormone issues, or PCOS, polycystic ovarian syndrome, both of which are heavy hitters when it comes to infertility. And beyond just the timing, we really have to look at the period itself. Most women experience some cramping. Sure, that's standard. But incredibly painful or super heavy periods that actually interfere with your daily life, that is not just bad cramps. That could actually be a major symptom of endometriosis. Plus, while a super stressful month or an intense new workout routine might cause you to miss a month here or there, having literally no periods for months at a time is a huge red flag. If it disappears for months, for sure it's time to get your fertility checked. Our bodies are these incredibly interconnected systems, right? So fertility issues often show up externally as signs of hormone fluctuations. We're talking skin issues, a sudden drop in your sex drive, unexpected facial hair growth, thinning hair, or just unexpected weight gain. These aren't just random, isolated annoyances. They are systemic red flags screaming that something might be off with your hormones, and it definitely warrants a chat with your doctor. I really want to pause on this next point because it's absolutely vital. Pain during sex is not normal. Unfortunately, some women have dealt with painful sex for their entire lives, and they basically just convince themselves it's par for the course. Well, it's not. Chronic pain during sex could be tied to hormone deficiencies, endometriosis, or other physical conditions that might also be actively sabotaging your fertility. Please do not suffer in silence or try to normalize that kind of pain. And that brings us to Section 3, common signs in men. Because infertility is absolutely a shared medical challenge. let's look at the male symptoms.
Just like we saw with women, a man's fertility is heavily linked to his overall hormone health. It's a delicate balance. When a man's hormones are out of whack, the reproductive system just can't do its job properly to create and deliver healthy sperm.
So how do those hormone drops actually look in day-to-day life? Well, two big indicators are changes in sexual desire and problems maintaining an erection. A man's virility and his ability to maintain an erection are very often directly governed by his hormone levels. So if those naturally drop or fluctuate out of nowhere, it can directly translate into trouble conceiving. It's basically your body's physical check engine light for an internal hormonal shift.
Then, we have the localized physical signs. The testes are the house for a man's sperm, making testicle health absolutely paramount here. If a guy is dealing with testicle pain or swelling, issues with ejaculation, or notices his testicles are unusually small or firm, these are critical physical signs. There are a handful of different conditions that can cause these symptoms, and a lot of them actively contribute to infertility. A medical practitioner really needs to explore these to rule out or treat any physical blockages.
All right, we've covered the reality and the symptoms for both sexes. Let's move to our final section, Section 4, the takeaway and next steps, because knowing the signs is only half the battle, right?
This data here brilliantly illustrates exactly why we have to view this as a shared journey. Look at the breakdown of causes. Female factor infertility is the root cause about 40% of the time, but male factor infertility is right on its heels at 35%. And in 25% of cases, it's actually a combination of both male and female factors. This right here visually proves that infertility is a shared issue. It is not just a woman's issue or a man's issue. It's a medical hurdle that couples tackle together.
So at what point should you stop trying on your own and actually call a doctor? Our sources clearly map out this timeline for us. For couples who are generally trying to conceive, the golden rule is to see a doctor if you've been trying for 1 year without any success. But keeping in mind that fertility issues do naturally increase with age, that timeline drops to just 6 months for women over the age of 35. Do not wait longer than these timelines to get checked out. Getting in early can open up so many more treatment options.
I want to leave you with this really important thought today. Even if you do get diagnosed with infertility, you may still be able to conceive. A diagnosis is not necessarily the end of the road. Medicine is constantly evolving, bringing us everything from new medications to incredibly advanced IVF protocols. If you recognize any of the signs we talked about today, or if you've hit those trying timelines, go make that appointment. You are never alone in this, and there is always reason to hold on to hope. So, knowing that this is a shared medical challenge, rather than some isolated failing, what steps will you take today to advocate for your own reproductive health? Thanks for hanging out with me for this explainer.